Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to all of you joining us here today. We are back again talking about our Gold Neonatal Conference, which we are truly excited to be launching very soon. Join us for our live keynote, which is going to be on May 31st. You can find out all the information on our website, of course, at goldneonatal.com. It will, of course, tell you things like your time zone, which is going to be really important for you if you're planning on attending any of the live sessions. And do note that everything is recorded for your convenience, so you can come and listen live, listen to the recording, or do both. So there's lots of options available for you. Now, I am super excited about having our next speaker here today. And I have to tell you that our conversations always go deep because she is definitely a person after my own heart in talking about this topic. But first of all, before we get into the topic, I would like to welcome Sarah Coutts to Gold Neonatal. Welcome, Sarah. It's great to have you here today.
Great. Thanks for having me.
Yes. Well, I mean, I am excited for more than just one reason about your topic, because I know you're also living in Canada. So perhaps you want to tell folks where you are in the world and what part of Canada you're in, and of course, what you do as part of your profession.
Yeah. So I'm in Vancouver, which is in the westernmost province of British Columbia of Canada. And I am trained as a neonatal nurse and as a lactation consultant, but more recently have just started a position as a developmental care specialist in a NICU in Vancouver. So it's exciting. It's a pretty new role for us. So we're navigating sort of how to do it, but yeah, it definitely is a mix of everything I'm passionate about. So, supporting families with breastfeeding and promoting, breast milk, and as well as skin to skin and decreasing separation. So I'm hoping it'll be the perfect fit.
Oh, that's good. Well, very exciting. Congratulations. What a great opportunity to explore something brand new. And you're going to be, I guess you're going to be writing the rules on it, shall we say, for those who are going to come behind you, which is wonderful. That's really wonderful. So Sarah, tell me a little bit about the beginnings of your story in terms of where you started and, and why you're here. I've actually been asking many of our presenters because they're similar in their practice to you, that, they went into nursing and then sort of started, working towards the neonatal unit. But what's your story? What's the background for you? Even maybe before you started nursing, what was the drive for you?
Yeah, I mean, I think for whatever reason, the NICU always was certainly my goal to get into it. And I did, and I worked in Vancouver for a while. And I actually went traveling to Africa and worked as a travel nurse there for 8 months. And to be honest, that's sort of where certainly my passion for kangaroo care really started. I just, and just seeing moms carry their babies in wraps, and it was just so amazing to see. And within that, moved to London, England, actually, and worked at a NICU in England, and just found the developmental care aspect there was very different from what I was used to, which was really exciting. And the way that parents were present in that NICU was amazing. Anyway, and that led me to doing my master's, and my project was in kangaroo care. And I think most people at the time thought I was crazy. And then, however the, research and the NICU world has evolved, where, kangaroo care has really been elevated in the last sort of 10, 15 years, despite it being around for over 40 years. So yeah, that led me back into the NICU, and I got an opportunity with perinatal services and doing implementation research project about improving kangaroo care in the NICU. And then, full circle, that's kind of come back here. So,
wow.
Yeah, no, it's been amazing. Who knew that that's where it all would turn out to go.
Yeah, that's amazing. Yeah, the stories are definitely, there's a common thread between everyone who works in the neonatal unit. And I actually think I said this last time on my last interview, but, people are very passionate. And once they're in, they really stay for longer periods of time, which to me seems quite surprising when the job is actually quite intensive. It's not a job, I think, for folks who, it's not light work by any means. There's so much involved, heightened heightened emotions on all parties. You're not just working with an infant, you're working with an entire family, but this is what you thrive on. This is what you thrive on, right?
Yeah, no, totally.
This is where you come into your own and sort of just feel probably I mean I can just hear it in your voice when you talk about including those families. So tell me a little bit about some of the differences or the challenges that perhaps you have seen in your career, that we didn't always include families as much as we do today. Things have shifted though, right, Sarah?
Yeah, no, I certainly think so. And and in my past experience, I was so lucky to go to 13 different NICUs in BC. And certainly
Mm,
that's what I saw. Everyone is doing their absolute best to
sure.
involve families despite the barriers. Every single NICU has a different footprint, whether
Yeah.
a chair can actually get beside the incubator, whether, there's a pump room or pumps even available and all those things. So I think it's certainly shifting towards family-centered care and integration of families and participating and welcoming them into the NICU.
Hmm.
But there's both physical, institutional, healthcare provider barriers that certainly I think are still there and need sort of healthcare providers need support to
Right.
overcome those and to get creative. I think, it's not always
Yeah.
an easy solution. And so really working with the teams there and trying to figure out new ways to do things.
Yeah, because you and I, we were talking offline earlier about just the elements of, like you said, kangaroo care has been around for over 40 years. Everyone sort of has an idea or knows about it, but what is the development? What is happening? And I think you're going to be talking about this, right, in your presentation.
Yeah. I think, yeah, like you said, we're all on this, we're kind of on this kangaroo care trajectory or journey,
Yeah,
all at different points. And so how can we learn from each other in that sense of like, how did you get there? And so I'm hoping that to share some of those ideas of how we improved implementation in different NICUs, and certainly hopefully practical ways. I know,
sure.
it's a lot of, you read research and you kind of go, oh, what are we going to do? So hopefully there's just even all the little small things that you can do that hopefully will create kind of bigger change in the
That's right.
NICU.
Yeah, no, that's going to be so important. I think this is a huge learning opportunity collaboratively. Like you said, I mean, you had the opportunity to go to 13 neonatal units. I mean, we've got people coming into this conference from all over the world, who probably likely are practicing kangaroo mother care, on site, but with potentially it's not fully at their full potential, right? Because that's what you have seen.
Yeah, no, I think it still is sometimes thought of as sort of very intermittent, and that I think is the
Right.
norm. That's
Yeah.
okay. And that's great. And I think, learning from other countries, certainly even, learning from Sweden and different countries that are actually really pushing the boundaries and going 24 hours and
Hmm.
looking at the supports that families need. So yeah, no, it's definitely how to optimize what you have and how you can make it better, for
Yeah.
sure.
Absolutely. Well, I think this is going to be great for our participants because I think they'll be able to contribute so much to this conversation. And I love it when we get presentations like yours. I know you're going to be working through some case studies, but we're going to benefit from hearing from our participants in this presentation too, because they're going to be sharing all their unique situations that we can discuss and talk about, and then, hopefully help them develop policies and programs and, find ways to get through those barriers, right?
Yeah, no, for certainly. And I, yeah, don't have the, golden ticket for sure. So, and
Right.
certainly I'm constantly, reaching out to people across Canada and other areas, just trying to figure out what they're doing. So, I'm excited. Yeah, for sure to meet different people, to hear what they're doing, what's been successful for them or, troubles that they've had. And certainly it'd be a great forum to collaborate and share. And yeah.
Awesome. Yeah. Well, that sounds fantastic. I know I'm super excited. I know that you and I have talked quite a bit at length, loving this topic so much, and I think that, we talked about, why are we asking about, how long we're doing skin to skin? We should be asking about how long we're separating, babies from parents, right? So it's a reversal of language that we need to get into. And I know that beautiful quote you're going to be sharing with with us from Niels Bergman during your presentation. So hold tight, everybody. You're in for a great experience with Sarah Coutts here at our Gold Neonatal Conference. Thank you so much, Sarah, for sitting down with us here today.
Thank you. Take care.
Yeah, I'm really looking forward to it. And again, for those of you joining us right now, you can head over to our website, goldneonatal.com. This particular presentation is titled, What is Stopping Us? Kangaroo Care Implementation in Neonatal Intensive Care Units. I am truly looking forward to this for sure. Well, thank you once again to Sarah Coutts for joining us here today. And of course, to all of you, our viewers, we can't wait to see you online at goldneonatal.com. Thank you again for joining us and have a wonderful rest of your day. Bye-bye for now, everyone.
Thank you.